I'll be your facilitator today, and we have started recording this meeting. Also helping me facilitate this session is Corey Chatis and Sean Cottrell, Bill Hurwitch, Amy Nicholas, and we also have Leanne Taylor helping us run Adobe behind the scenes. So thank you very much. And as I mentioned, this is the third session of 3. And today we'll be focusing on identifying and discussing ways in which SLDSs can be used to meet COVID-19 needs. Briefly, our objectives are to hear from 3 states today who have already figured out ways to connect their SLDS resources to COVID-19 needs. We will have 15 minutes from each of the presenters, including a little bit of time for question and answers. And then we will move into a breakout room where we can have a more intimate discussion about what is happening in your state or territory, and again, start thinking about ways in which you might be able to use your resources in your state to meet the needs of your stakeholders. And so without further ado, let me move through our slides just a little bit. And our speakers today are all from the Midwest. From Minnesota, we have Jennifer Verbruge, and she'll be talking about how they use their SLDS to identify emergency child care sites. From Indiana, Tyler Brown will be talking about how they've used their SLDS resources to understand or start to understand the impact of COVID-19 from a data set and analytics perspective. And then finally, we will hear from Trina Anderson and Fawn Dunbar in Michigan, who have used their SLDS to support their state's pandemic debit card program. Before we jump into these presentations, I'd like to prime each of you for our breakout session. And so when we go into our breakout sessions, we'll be asking you to sort of consider these 3 questions. What are some use cases in your state or potential use cases? And as you sort of think through those use cases, try to define what that problem or question is, and then think about what your answers might look like. Also along the way, think about resources and partnerships that would help facilitate your work. And as the discussion unfolds, I would encourage you all to think about if there are any common metrics that could help the collective. Also, and before we jump into our first presentation, I would like to encourage all of you to use the chat window to enter in questions as we go through the presentations. What we will be doing behind the scenes is pulling your questions out and queuing them up for the end of each presenter's slideshow. We've asked them to reserve a little bit of time so that we can take 1 or maybe 2 questions at the very end. And so we'll go, each presenter has its own question and answer session. And without further ado, I will hand it over to Jennifer in Minnesota.
All right. Hi, everyone, and thanks for joining us today. I am Jennifer Verbruge, and I oversee the Early Childhood Longitudinal Data System at the Minnesota Department of Education. I want to start with a little history of our ECLDS. We launched the system in 2016, building it originally with Race to the Top grant funds. And it links data primarily from the Minnesota Departments of Education, Human Services, and Health. And we look at educational outcomes of children who participate in Minnesota's public programs and services. So that's the goal of our ECLDS. So while the ECLDS site itself includes primarily public data reports, we have also branched out into making available some maps on our website to support the work of our data users. So I'm going to be talking mostly about those maps today. You can visit the Minnesota ECLDS at eclds.mn.gov. So knowing we wanted to expand into maps on the ECLDS site and recognizing that there are many overlapping jurisdictions in Minnesota for early childhood, districts, counties, health boards, Head Start agency boundaries, and more, which is, I'm sure, true of all of the states who are represented here on the workshop today. We built a boundaries and sites map to give users a visual understanding of where those overlaps happen. And this was our first map, and you're looking at a screenshot of that map with a couple of the layers selected just to give you an idea of what it looks like. After the ECLDS
Jennifer,
Yep.
I'm sorry to interrupt you. Could you turn on your camera, please?
Thank you. I thought it was. Good. Thank you for reminding me. So after the ECLDS was launched, we received a federal grant to build and expand its resources. And in response to requests from Head Start agencies specifically, we built the Comprehensive Services Map to provide local users with geographic information on the sites that were nearest to them that can provide assistance and resources. And you're looking at a screenshot of that map here on this slide. The ECLDS Comprehensive Services Map also supports local planning across program areas and departments, especially for needs assessments, keeping in mind that Head Start agencies are federally required to conduct needs assessments every 5 years, and Minnesota ECFE, or Early Childhood Family Education programs, have to submit community needs assessments annually. Sources originally included in this map were inspired by the Children's Defense Fund of Minnesota's Bridge to Benefit. And that's an online project to improve the well-being of families and individuals by linking them to public work support programs and tax credits. And that's through an online eligibility survey. But we also later added other map layers such as public libraries, workforce centers, and food pantries. And I encourage you to take some time after the workshop to explore this map to see how it works. I think it's pretty cool and has proven to be a pretty important resource for a number of different agencies and organizations. And then COVID-19 came to town. So on March 16th, my colleague Avija Whiteman and I were first asked to brainstorm alternative uses for our Comprehensive Services Map and as a potential COVID-19 support resource. We offered some ideas, not really knowing what might stick or what anybody was really actually looking for. And then the next day, we got an email from our supervisor that said that leadership wanted to know if the map gives us child care and school locations in relation to hospitals statewide. And it did not. And then also state leadership asked about nursing homes and correctional facilities on the map, and we also did not have those. And so began not just a flurry, but a snowstorm of emails among many people trying to get these resources put onto the map. So Avija and I worked with our supervisor and also with the Minnesota Departments of Health, Human Services, and the Department of Corrections to very quickly pull together lists of hospitals, nursing homes, and correctional facilities. And with state IT staff, we were able to get those new layers added to the Comprehensive Services Map within 3 days. So we were pretty proud of that. And then a week or so later, the state's administrative agency, which is called Minnesota Management and Budget, or MMB for short, sent us a list of emergency child care site information. So that was child care sites that were willing to serve children of critical sector workers so that those workers could keep working. On March 25th, we posted the emergency child care sites to the Comprehensive Services Map. So in a week and a half, we scrambled hard and we were really proud of what we put together and that we were able to do something actually fruitful and helpful in the fight against COVID. But we were never really told by leadership what their end goal was for all these map updates. So we just did what we were asked and we weren't exactly sure what was going to happen with that. And then, in the meantime, as we were doing all that scrambling around to make our map updates, MMB built and released its own map of child care providers for essential workers, and that was powered by Tableau. And there's a screenshot of that map there you can see. And this actually became the official map of child care sites willing to serve children of essential workers. As a side note, it's estimated that 420,000 Minnesota kids are in households with 1 or 2 working parents that are in critical sectors. So that's a lot of kids that need care. MMB gathered, and they continue to gather, this child care site information from online survey responses through the work of the Minnesota Children's Cabinet. So with the creation of this new map by MMB, we were left unsure of what the updated comprehensive services map function would be as a COVID-19 resource. Also in March in Minnesota, it was announced that $30 million in legislative funding was proposed for emergency grants to licensed child care providers serving the children of essential workers during the COVID-19 public health emergency. And on April 2nd, we were contacted by the Minnesota Children's Cabinet wondering if we might work with Child Care Aware of Minnesota, which is our state child care resource and referral agency, to try to use the comprehensive services map in order to help score and determine grantees for the peacetime emergency child care grants using the scoring criteria that was dictated in the legislation. So they had a particular interest in understanding applicants' proximity to the essential services that we had mapped, including hospitals, nursing homes, and correctional facilities. And I will say here that having somebody in our children's cabinet who had built the Bridge to Benefits project and had worked with GIS software analysis before was helpful, and that she also had served as an advisor on our comprehensive services map project. So she had a pretty good understanding of what this resource was capable of doing. So with support from ITGIS, which is Geographic Information Systems, staff behind the scenes, we were able to use the data tables that we had embedded in our maps to find driving distance from child care sites to these critical sites, the hospitals, the nursing homes, and the correctional facilities. And this was just one measure among many other criteria, which you can see listed here. These are the first grant round criteria that help Child Care Aware of Minnesota determine which applicants would get the money that so many child care programs and sites applied for. All right. It is, okay. So since the middle of March, when we added the new COVID-19 resource layers, those particular layers have been accessed nearly 300 times combined. So we know it's getting some use, some traction. But it's hard to know exactly what the impact of our work at MDE has been. We do know that the existence of our maps, enhanced in a rush with those few more layers, enabled the state to more quickly respond with financial support for child care sites that stepped up to play a critical role for our essential workers during this crisis. $40 million in total in those Minnesota Peacetime Emergency Child Care Grants were awarded across 5,400 awards over 3 months to ensure that emergency worker access to child care during business closures continued. There was an additional $10 million from the Child Care and Development Block Grant, so that was that plus $30 million from the legislature, that equals $40 million. We know that child care provider needs have outpaced the dollars appropriated in Minnesota by more than 3 times. And our data helped Child Care Aware of Minnesota prioritize those grant recipients, and we were glad to have helped this way. And it was just recently announced that another $56.6 million in child care grants will be administered by our Department of Human Services and to go to supporting health and safety at child care sites during the pandemic. I don't know that the comprehensive services map will be used in that scoring rubric, but I hope it is, and we will be here if they need us. And that's it. I didn't see any questions.
Yeah, I have not seen any questions yet. I will pause here briefly. Jennifer, that was very interesting. While we're waiting for questions, could you talk a little bit about what you think the life cycle of the products that you have produced so far? Do you envision circling back through them, making enhancements, or moving into new areas of work?
For sure, yeah. So with our comprehensive service map, I have a schedule to update our resources on there at least once a year. sometimes more depending on the data source that we're using there. So we try our best to keep it updated, and we'll continue to add layers to the map as needed. I really like now that we have those additional resources included on the map, because it just makes it that much more usable. It's not necessarily needed for some of those needs assessments that I mentioned for Head Start and ECFE, but other people can, anybody can use this, the public can use this map to find resources closest to them. So the richer it is with resource, the better.
Great, thank you. And you actually answered my other question, which was who are potentially the user set that you're supporting. So it sounds like pretty much everybody. Yeah, yep. And we're trying to share information about the map's existence with as many people as we can. And we have partners in our agencies or our state agencies who are sharing the information with their clientele and their stakeholders to let them know that it exists. So yeah, and anybody can get to it. It's a public website. We hope that it's useful even beyond what we had anticipated. Great, thank you. Thanks. If you do have a question, go ahead and type it in. And even though we may not be able to address it during today's session, we will follow up via email and make sure that we have connect your question to the appropriate presenter. So please use the main chat window to type in your questions. And we have a few people that are connected through their computer audio. If you're one of those 4 people, please have Adobe Dial U. You can access that option underneath the green telephone icon at the top of the screen. You do want Adobe to dial you out. You want Adobe to dial out to you so you can participate in both the in the audio for the breakout rooms. With that said, I think we will transition over to Tyler Brown in Indiana to hear about how they've used their SLDS to know something about the impact of COVID-19 in their state. I'm going to turn my camera off, and Tyler, if you could turn your camera on, that would be great.
Yeah, thank you, Jeff.
Thank you.
Can everybody see my camera now?
Oh, good. Yes, we see you.
Hello,
thank
everybody.
You.
I hope everybody's doing well today. Thanks for letting me share and present before this group today. My name is Tyler Brown, Director of Engagement Analytics at the Management Performance Hub in Indiana. Today I'm going to talk about and focus on how Indiana has leveraged its SLDS, and probably more importantly our SLDS infrastructure, to really ramp up our data sharing efforts in support of our COVID-19 response. First, I just want to give a little bit of background about the MPH. We do operate our SLDS for the state of Indiana, but beyond that, we also have a two-pronged mission that kind of is associated with our SLDS, but it also goes a little bit beyond. So we're really focused on obviously breaking down and connecting disparate data systems within the state, connecting data, but probably more importantly for the conversation today is connecting people, researchers, experts, policymakers with that data so that we can really empower data-driven decision-making in our state. Actually, these are a little bit out of order, so I'm going to go back to that slide. So historically, our data sharing efforts, at least through the MPH and our SLDS, have really looked like this visualization. Even though we're breaking down data silos, combining data sets so we can look cross-sector at some of these problems that we're trying to tackle, really a lot of it is, there's a lot of groups within state government, outside in research centers, universities, that have very distinct expertise in these areas. Traditionally, if we were to share with these people, we would provide them a data set. They would work on it, and there'd be little collaboration, or if there was collaboration, it'd be difficult, just due to how we have to share these data sets. Really what we've looked to do in the platform that I'm going to describe today is to put the data into a platform and allow the users, in this case the public health experts in our state, to come in, collaborate, look at the data, and really help drive our policy from a very data-driven perspective. This platform that we've rolled out recently is what we've referred to in the state as the enhanced research environment. Really, it's a hardened data sharing platform in which researchers can access data in a secure environment. Essentially, it's virtual desktop infrastructures where we can port approved data sets and allow the researchers to come and interact with those data sets, analyze those data sets, and most importantly, collaborate on the findings that they're doing with the data. It's important to note that a big piece of this was actually started prior to the COVID-19, and we kind of just lucked into having this solution ready when the pandemic hit. Really, this is also a big effort for us just with external data sharing with researchers in the community to kind of help us with our security posture, especially as data sets leave the state. This would give us an opportunity to share data, get interesting findings, but never have that data leave state systems. Currently, this is largely powering the state's public COVID-19 response team with our public health experts. A couple of projects, and then I'll hone in on a specific use case that we've used this platform for. So really, this is all about connecting not just the data, but the experts to the data in this collaboration piece. Things that are happening in this environment with these public health experts. We've done a randomized testing project that I will dive more into later in the slides. We're doing predictive modeling quite often, just trying to understand the ebbs and flows of the virus and its impact on the state. And then we're also powering our operational dashboards that we're using, our governor's using in his press conferences. On the last slide, I have resources for people to look at around those dashboards. Diving into this randomized testing project a little bit. Really, this was an initiative with our Indiana State Department of Health, but then also the Indiana University, Purdue University, Indianapolis, Fairbanks School of Public Health. The picture in here is a little hard to see, but it kind of gives you kind of the timeline. So this is early on in the pandemic, really whenever testing really wasn't widespread in our state. So we were getting a lot of questions around, can we start to understand infection rates as opposed to just positive cases. What we were able to do using our SLDS infrastructure around national data sets, but also through this enhanced research environment, was to provide these data sets, match these data sets, put them into this environment for the experts to play with, but also allowed us to kind of understand how to build out a representative sample that we could, have this randomized testing from. Some key insights from this. Obviously, it allows us to work within our legal and security frameworks, but it really allows us to work quickly, and really important around a pandemic and kind of the response around to that. So really, efforts that might have taken a month prior are really being turned around in very quick manners because we don't have to worry about understanding what happens with that data after it leaves our infrastructure. One of the key findings of that randomized testing project, so they selected around 5,000 Hoosiers, voluntary testing. And really at the time, we had seen, 17,000 positive cases based on the testing. But what we were able to find through this modeling that was done through the Fairbanks School at IUPUI, was to better understand our infection rate, more widespread, and most importantly, like the asymptomatic positive cases through that. As I mentioned earlier, I have some resources here. I don't know if these slides will be made available, but we have tons of resources around the data sets that are being used and aggregated up for the public. We have a dashboard that's updated daily on positive cases, and then there's also a lot more information than I could probably dive into on this random sample project and kind of the methodology that was used. And then I've also included some contact information, mine, and as well as our chief data officers. We're always happy to work with other states. Feel free to reach out. That is all I had, Jeff.
Great. Thank you, Tyler.
Open to questions.
We'll pause briefly to see if folks would like to type in a question or two into our chat window. And while we wait for that, and I'm trying to turn my camera back on, there I am. Corey's typing in a question, it looks like. I guess I have a general question, Tyler, and that is, so you said you got lucky in that you had a lot of this infrastructure set up, and it was in place when the pandemic really started to pick up. Did you engage stakeholders to kind of figure out, like, how do you assemble and what do you need to make available? And if you did, if you could talk about that a little bit, that might be interesting.
Yeah, so it is kind of interesting, kind of the evolution of the project. So really, as I mentioned just briefly, really this environment was really set up for much more, our normal SLDS data sharing operation.
Right.
And really with a focus on how can we not have to do a lot of the, work to understand how this data is going to be secured once it leaves our systems.
Right.
So really this was really designed for that, and there was a lot of stakeholder engagement around that. And what we could port into these environments, they are hardened, so nothing can leave the environment without an approval process from the data owners or the agencies that we're working with. But tools that we can import in there that researchers are using, analytics tools, there's a lot of stakeholder engagement around how we can make this useful for folks.
Great, thank you.
And it, yep.
Sounded like you were going to add something else, so feel free.
No, I was just going to say, and then around the COVID-19, daily, our staff is facilitating. We're more of the technical experts, I would say, around this, but, just finding out how we can empower the experts to use the data, use it efficiently, use it effectively, use it quickly as possible. Yeah, that's happening on a daily basis, as I'm sure it is everywhere.
Right. Excellent. All righty. So again, just a reminder to folks, if you do have a question for Tyler or for any of the presenters, as we move forward, please drop them into the chat or reach out to them directly. Or if you would prefer, we'll have our contact information up at the very end, and we can help facilitate those conversations. Corey made a good point. In the chat window, we will make this PowerPoint recording available through Communities 360. And so, again, just a reminder, if you're not connected through the dial-out feature in Adobe, you probably should be if you can manage that. It is important for our breakout session, which will be coming up after our next presenter. So Tyler, thank you very much for that presentation. And we will now transition to our friends in Michigan. We have Trina Anderson and Fawn Dunbar. And I will hand it over to y'all to talk through your slides, and I will turn my camera off.
Thanks very much, Jack. Yes, we're going to talk a bit about how Michigan used our SLDS to support the pandemic EBT mission of the Department of Health and Human Services and Department of Education. I'm Trina Anderson. I'll be going through the presentation, and I'm joined by Fawn Dunbar. Fawn was our lead analyst who worked really closely with the other state agencies and partners on the data pulls and all of the modifications throughout the project. We're both part of the Center for Educational Performance and Information, which is an agency within the state budget office that actually oversees all of the state education data collections and a majority of our federal and state compliance reporting. So just real quick, the need in mid-March, there was a recognition and the start of the program for offering pandemic EBT cards for funding for families in need of emergency food during the pandemic. These cards enabled nearly $200 per student per month to get out there. And really what the Department of Health and Human Services needed from us was a list of all of the students in Michigan who were eligible for free and reduced price meals, along with their addresses, in order to either load cards if their families already had an electronic benefit transfer card, or mail cards to the families. We were partnered with Health and Human Services, the Department of Education, Information Technology, and then ourselves were another partner in this. The impact in Michigan was significant. We were able to reach nearly 900,000 students' families for these, and more than 500,000 families had not been receiving EBT funds prior to the pandemic. So when you're talking about almost $200 per student each month in Michigan, that was almost $180 million in benefits getting out to families each month that we were able to get this information over to Health and Human Services. So really big benefit in enabling this. Starting point, I'm going to back up just a hair from what I have on the slide, and actually the starting point in Michigan, we actually started assigning a state unique identification code to students operationally in 2003. We received in 2006 an SLDS grant, and we actually rewrote the system that was leveraging the unique identification code and collecting data on all public school students in the state. In 2007, we partnered with the Department of Education and Health and Human Services on an automated process for directly certifying students for meals. So I'm saying that because we had some long-term infrastructure in place that really enabled us to jump on board to this program during the pandemic. In 2017, we modified those data sharing agreements that were in place across our agencies in order to help the Department of Health and Human Services provide summer EBT cards to students. So that was pretty significant because up until that point, Health and Human Services had actually been trying to reach each of the 900 school districts in the state and get a roster from each school district for students for providing those summer EBT cards. In 2017, we were able to get data sharing agreements on the ground and start providing Health and Human Services with those rosters of students and addresses. So that for us was a starting point for responding to the pandemic EBT. We had existing data sharing agreements in place, business rules, and data elements that we were able to really jump off from. And what that meant was those families that were existing, had EBT cards already in place, they were able to get those loaded very quickly in the process. We went through a lot of modifications throughout the course of this. Michigan was one of the very first states to be able to get the PEBT program off the ground. And that meant that we were really building as we were flying. And Fawn, who's on the call with me, she was really key in that. We started, we were providing a new file every other week, and every other week there was modifications to it. So we were constantly modifying both the data files, the data sharing agreements, to meet the changing needs. There were populations that were being added, such as early childhood programs, non-public school students, and we were adding information to the data file. For example, homeless information, so that DHHS could troubleshoot why certain cards were being returned. The timeline was pretty aggressive. My colleague and I, we had our first conversation with the Department of Education on March 16th. We had a data sharing agreement signed and in place by March 27th, and the first sample file was delivered on March 30th. 2 weeks after that, we started delivering the operational files, and those went bi-weekly, and the last file was just delivered a week and a half ago. We had resources from all 4 of the partners. From our organization, we had data quality analysts constantly checking the data as it was coming in, customer support responding to families and school districts on why did some families receive cards and not others, data collection analysts, reporting analysts, as well as folks that were responsible for transferring these confidential files over to our partner agencies. And from IT, we had DBAs, developers, Department of Education and Department of Health and Human Services both had project managers on this, as well as their program folks and technical support staff. Limitations and challenges to this. Well, while we had a lot of things in place and could really respond quickly, we were limited. So our initial data sources were pulling data from our October and February count days. We were struggling accordingly with poor address quality. These first pieces, mailings were going out in April, and it was dependent on addresses in February. Pandemic really hit in March in Michigan. We had a state of emergency go into effect then. People were getting laid off. And students were no longer in session. So there were a lot of challenges accordingly with the addresses. We were working and pulling in non-public school students. We had rosters for students, but the only indication of whether a student was eligible for free and reduced price lunch was if we had them directly certified. So we had to build a new mechanism for schools, non-public schools, to actually submit rosters of students who were eligible for free and reduced price meal based on their applications. So very quickly on the fly, built a brand new data collection and partnered with the department, both of the departments, on communicating out to the non-public schools in the state for getting more information into us so that those benefits could be extended further in the state. As I mentioned before, Michigan was the first state to implement, so guidance was pretty limited and constantly evolving. Our partners were continuously modifying rules and populations as that guidance evolved, and we were continuing to respond and really work on the fly with this. We were also doing something, this wasn't simply a straight pull out of our state longitudinal data system, but we were actually leveraging data from multiple sources in order to have the most current information available. So that meant, as I mentioned, we had a new data collection for non-public school students, but that was only pulling in information on their eligibility. It had to be woven in with other collections for their address information and other characteristics that Health and Human Services needed. Not all of the resources across the agencies were familiar with the various data sources we were pulling together. And we were also pulling in some data that was in process. So we were trying to run so quickly that some of the data was still actually in motion, and we were just pulling in error-free records that hadn't even been fully certified yet. And then going back through and making sure everything was up to snuff on that, and doing checks to make sure we weren't overpopulating or under-identifying students. So those pieces, those are some of our limitations and challenges in the process.
We also had a lot of in-flight enhancements. Extensive communications were going out to the schools throughout this in telling them, hey, you need to send us updated addresses. If anything's changed, here's a mechanism. We have what's called a capability for districts to submit a maintenance record in between data collections, and then we were pulling those new addresses in. We were working, the departments were also engaging school administrators in order to deliver cards to homeless students. If we didn't have an address on file and we were telling Health and Human Services these students are homeless, they were able to then provide cards to the school districts for delivery. As I mentioned, we developed new data collections. We modified existing collections in order to ensure everything that was relevant could be reported for as many students and children as possible. And we also modified our direct certification matching process with Health and Human Services through mid-June in order to be continuously identifying eligible students. So it was a lot of work, but pretty exciting that we were able to service so many children in the state accordingly. And that's everything. If you have questions, we're happy to answer those.
Thank you, Trina. That was really interesting. We do have a question in the chat window, and we have another one coming in. Avizia Whiteman asks, and I'm just going to read it to you, unless you would prefer to read it yourself, but for the recording's sake, I'll just read it out loud, I guess. She is interested in learning how different states ensured equity in early childhood for programs. So if there were Head Start or CACFP, or other programs with equivalent incomes, how did they get paid?
Okay, so that's a great question. We did include early childhood programs in this process, and in fact had communications going out to Head Start agencies. We do have some Head Start programs that report to us, and we included all Head Start participants in the data file going over to DHHS because their income levels to be eligible for Head Start participation were such that they would be considered, eligible for free meals and eligible for the PEBT. For those entities that hadn't historically reported to us, we had the collection open so that they could report those rosters of children. And then I see Laia Titerman has a question on how we address issues with student addresses. That is a great question. It's one that we are actually continuing to struggle with because we collect, we don't have two sets of addresses. So we don't collect separately mailing address and physical address. Physical address is required for verifying residency for our state aid payment process. We have an address line 2, which we had historically communicated to folks. If you have a different mailing address, such as a P.O. box, put that in line 2. Had several problems with that, and actually, Fawn, if you want to jump in a little bit on this address piece, okay. I think that would be great.
Yep. So we found we learned a lot about the how districts were using the address fields for the students. We discovered that they were entering, so for shared custody situations, we discovered that they were entering on address line 1, one address, that's just the street address, and then in the city, in the state, and the zip, they would put that information. But then on address line 2, they would put an entirely different address, including city, state, and zip for the other parent. And unfortunately, when DHHS was trying to print out envelopes to mail out letters letting them know of the benefit and how to access it, and then they would follow up with a card separately, that doesn't work. The post office couldn't deliver those. So we had to do some messaging out to the districts to help clarify what needed to be in the address information and what shouldn't be in there. And so districts could submit a corrected address. So just recently, like day before yesterday, I pulled all of the address changes that had been submitted for students since they were first identified, and it was a list of almost 50,000. And DHHS is still, and MDE, Michigan Department of Education, are still trying to figure out how to use that information and get the cards. They also set up a call log for people to call in to check and troubleshoot issues with getting cards. So we're trying to respond to those, and in some cases they were providing addresses through that.
So
and
did you or one of your partner agencies run those addresses through some kind of check against U.S. like post office, like standardized?
Yep. Well, yes and no. So I pull data using a tool called Fast Enterprise Guide, and in there you can do a little bit to identify, changed addresses, but it doesn't pick up on things. We would get districts submitting, originally they told us that they lived on Elm Road, ROAD, and then later we'd get a corrected address and they would abbreviate the word road to RD, and this doesn't help with that. We had quite a few things like that. And so subsequently when the files got over to DHHS, they have some kind of software. Unfortunately, I don't know what it is. I can ask and provide that information back out to Jeff, and he can share with the group if you're interested in that. But they were able to pick up on some of the issues with the addresses, like the two completely different addresses using their software.
Yeah, that is really interesting, and I think that's a great idea to again plug that what we will do is consolidate all of these questions into a discussion thread in the Communities 360 workspace that we've set up for this virtual workshop, and so we can have our presenters respond and follow up with these with maybe more detail or more specific detail. Again, we have another follow-up question, but I think it is time for us to transition into our breakout session. So let me set the stage just a little bit for that. So we're going to randomly assign our attendees today, and that will give us balanced room numbers. Our presenters will be spread across the 5 breakout rooms, but we only have 4 presenters, so 1 breakout room will not have a presenter. Also, I'll just note that a few people are connected in a way that they will not be able to contribute to the discussion verbally, and so those folks will also be spread out across the breakout rooms so that they don't just accidentally or randomly get clumped in together. As you go into the breakout room, the discussion point is, again, sort of thinking more closely to home in terms of your SLDS and your state needs and the needs that COVID-19 is presenting, and thinking about ways of connecting the resources of your SLDS to the pandemic needs. And go as far as you can in terms of defining what that use case might be. Maybe it will be helpful to write it as a question, or maybe it will be helpful to write it as a descriptive, like, we need a report like what we saw from Minnesota. in addition to that, think about resources and partnerships that would facilitate work towards those those use cases. And as you discuss your individual needs and your ideas, if any common metrics kind of start to percolate up, make a note of what those common metrics are. Our breakout session will last we will do a hard stop at 4:15. So that is 24 minutes, 23 minutes about. When we stop, so we'll give you a 1-minute warning. We'll wrap up the breakout rooms. We'll come back, and the facilitators for your rooms will report out. And then we will do some wrap-ups, some next steps. We've got some resources to share, and of course, we need to do an evaluation too, because we're still figuring out how are we going to keep collaborating and interacting in the workshop manner in the COVID-19 world that we live in. So without further ado, Leanne, could you assign us to our breakout rooms and our room facilitators, if you could go ahead and initiate the conversations and use the Google Sheets to take notes. Copious notes are always good. Thank you.
Let's have a law. Oh, and it looks like we're in the main session.
Maybe, but yeah, it has been an opportunity to collaborate and help them administer such an important benefit to people who are obviously in need. And I think that this will help immensely with our relationship between both MDE and DHHS. And then word will filter out to other agencies. And so I expect that we'll continue to reap some positive feels from this.
Great. Thank you very much. All right. Jeff, we're back.
Welcome back, everybody. We have reassembled. It's always a little bit of a shift to just kind of pop in and pop out. But here we are back together as a large group. And what we will have now is a report out for the next 10 minutes or so. We'll hear from each of the 5 breakout rooms, and I will go first. I will just kind of say that our conversation started with kind of thinking about big picture, where are the areas of work, and how do we sort of figure out what those priorities are, and thinking about how each of our own organizations are designed and what resources or processes we might have in place around data governance or research agendas, and how policy and leadership is sort of, in practice implemented in our agency. So quite a bit of variation there, and there were no silver bullets, as I can imagine nobody would really expect, since we're just kind of getting into it. But we did sort of talk about, one, making sure that the priority is appropriate around the real need, which is supporting, for some people, supporting schools and supporting districts, teachers, and students in a really meaningful way. And that might mean that some analytic work that we might care deeply about just doesn't have priority right now. And so balancing those priorities and getting clarity and leadership and support for setting those priorities is important. And then the other thing that we talked about was just having a better understanding of how things are going to be impacted, whether it's student learning and teaching itself, or if it's just how are our data collections impacting, what will our data mean in the 2021 school year versus pre-COVID, and will they have enough of the same meetings post-COVID that they did to really understand how they fit into some of these support structures like identifying struggling students or other predictive systems that are designed to lead to further actions and engagements. And so I'll pause there, and I think we can go on to Corey, if you'd like to do a report out for your room.
Sure, be glad to, Jeff.
You're on.
So,
yep, there you are.
Can you hear me now? Okay. So we had 4 states in our room: Indiana, Vermont, American Samoa, and Kansas. And our conversation ended up focusing more on data collection and data quality impact and strategies in response to COVID. So we had a majority of folks that are coming from a K-12 perspective, and 2 particular topics that came up were, and this actually came up in the breakout rooms for session 1 as well, is this conundrum of attendance. And what do we mean by attendance during the days of sometimes all remote, sometimes hybrid learning for the coming school year? And so one strategy is using a pre-existing approach that they have for tutoring models or tutoring programs, which is sort of, logging in, engaging with the content remotely counts as attendance for the day, even though the day may be actually a session. So that was one. And then the second was, and this came up during our state presentations in the full group, was this issue of address data and the increasing need in response to COVID and probably otherwise for high quality address data, and the challenges associated with that in terms of standardization, consistency, these data either not having been collected at all before or having been collected but never really being pressure tested in terms of their quality. So that might be a topic to return to in some of our future TA.
I agree.
Thank you. Amy?
We also talked about student engagement for a little bit at the end before we got cut off, and the, of course, popular interest among stakeholders in measuring and examining student engagement during this time of remote learning, and the difference between engagement and attendance and how it would typically be measured in a brick and mortar situation. But we spent the majority of our time talking more about Michigan's work to support PEPT, specifically around the complexities of health and human services data and matching them with ed records. There could be disconnect in many cases around how information about students is collected by health and human services entities, particularly around SNAP participation. So that led to a conversation about a first step in trying to break down those barriers is really taking a closer look at the direct certification process, both at the local and the statewide level, as that foundational step in streamlining the data sharing. There's often a lot of back and forth and piecemeal steps involved in those processes, particularly around particular student populations like homeless students, and getting accurate information about students that is causing a very high level of effort at the state SLDS end of things, and truthfully leading to a lot of frustration. So trying to work out those very complex kinks.
Okay, this is Bill, and then our room, it was interesting. The hot topic was free and reduced lunch. We had 4 states, and 3 of them where that was their primary use case, including Michigan, where we had lucky to have Fawn with us at the time. We also, like Corey, we did talk about address data, especially for tracking homeless students for free and reduced lunch. Being able to find their mailing address or finding a way to get the cards or what they needed for lunch to them. So that was another issue. Related issue was health data, vaccinations, data that was been collected in the past, but a much stronger need now with COVID to collect more detailed health data, being able to track now that we have remote versus in-school students. So that was one of the other issues that came up. Interesting discussion about the work that's being done in Wisconsin and Nebraska using EdFi to provide digital equity, being able to track devices, to be able to ease the burden on the local SIS vendors. So there's some good work being done in those 2 states. And then we also got Michigan has one advantage, which Fawn talked about, is that being from the budget office, It really made it a little bit easier to deal with both Department of Education and Health and Human Services and some of the challenges on getting them to collaborate and to share data. But using the budget office, it made it a little bit easier. And so that's pretty much what we covered.
Excellent. Thanks, Bill. So in breakout group 5, it sounded like we covered some of the similar topics that were covered in a few of the other rooms. We touched on address data, some data quality issues with now the focus on that particular data element and how, again, standardization around collecting that, or what happens if in line 1 and line 2 of the address information we see a complete address, and we print out address labels, and oops, all of a sudden, now we have to redo those types of things. So sort of keeping that data quality piece in mind. We did also talk, again, on that tie-in to quality, but really the impact on, or for the potential impact on the longitudinal data due to some of those data quality or potential data quality issues, and not necessarily on the student data side, but also on the data that state departments of ed keep on teachers and licensing information like that. But great conversation in group 5. I think you might be muted, Jeff.
I sure was. Thank you very much. Thank you, everybody. So let's talk briefly about wrapping up and next steps, because we are at the beginning of this process in many ways, the tip of the iceberg. We have assembled some additional resources, which in listening to our reporters report out, I do think these are worth a look. There's quite a spread here. First off, we do have our Communities 360 space set up. So if you have things to share, that'd be a perfect thing to do, a perfect place to do that. We will do our question and answer documentation there as well. The RAIL program has a nice clearinghouse of work related to understanding and providing COVID-19 resources. The data quality campaign similarly has been focusing very much on thinking about state policy in relation to data systems and COVID-19. I will say that you do need to type in a search term in that URL takes you to a general page, and you'll want to type in COVID works, I think, pretty well, because sometimes it's hyphenated and sometimes it's not. And then the Center for Assessment has quite a few resources on response resources to COVID-19. Again, lots of resources are embedded in each of these sites, so please take a look at those. And if you have other places, other sites that you would like to share, please do share that, and either through Communities or through the listserv. So any follow-up questions and comments and afterthoughts, please direct them directly to here, to us. And you've seen this slide before. I won't belabor this because we have a very important ask for all of you, and that is our evaluation survey. Since this is the 3rd session in the first virtual workshop that we've delivered this year, it is important that we get as many thoughtful replies to the evaluation survey as possible. And we do have 2 new questions on here that are reflective of the series in general. And also, one of them will prompt you to think about what would you like to see in the future. And this is very important that we hear from each of you in as much detail as you can provide. And thank you, Corey, for typing that link into the chat window. And you can also click the link directly on the PowerPoint, thanks to Adobe's designers. We will make the recording and the PowerPoint available, and you can also reach out to the 3 state presenters if you wish to do so, or you can work with your point of contact to facilitate that conversation. And we are looking very much forward into having ongoing conversations. I'd like to finish with a big thank you to each of our presenters. They worked very hard on their presentations, and the work that they represent is truly an impressive array. And thank you, facilitators, and thank you, participants, for spending your time with us, and we hope to hear from you soon. We'll sign off at that. Thank you.